What's up, folks? Let's learn about something new, a new protocol. It's actually kind of old, but for you guys, for civilians, it will be quite new because people don't use that much. Okay, so as such, you know that we have learned of blast injuries and bullet wound injuries. It's very, very nice and very, very easier than compared to the normal ATLS protocol. It's a derivative which every combatant and every personnel who is in the combat zone uses this algorithm, and the best algorithm to remember by the name or the mnemonic, which we can say, is MARCH. MARCH. So M stands for massive bleed, S stands for airway, R stands for respiratory, C stands for circulation, H stands for head injury / hypothermia. So what you need to do is make sure that you always check is there any massive bleed by just sweeping your hands all around and checking is there any bleed on your hands. If you see, stop right there and check if the bleed is positive or not. And if it is negative, check the airway to check the GCS, and also there is the airway pattern or not, and check for the respiration. For the respiratory type, in tactile way, you'll hear a sound called a wheezing or a swooshing sound. If that is there on the lung area, then consider your person has a barotrauma or a lung or probably a pneumothorax. So then proceed with the treatment according to as I've told you earlier. Now, going through that, go for the hypothermia. Check the temperature. Is the patient feeling cold or not? If the patient is responding to you, then if the patient says, or else check by the temperature. You can check by hands or something by just removing the glove. Now the other thing is head injury. Check, is there any neurotrauma based on that patient, because that is also way too easy, is very lethal also if the patient has gone through a bullet wound injury on the head and stuff. And if the patient is not at all responding on the care under fire, always remember, proceed according to the next patient as soon as possible, and make sure that the scene safety is always there for the care under fire also. The care under fire protocol is very necessary before you proceed in a MARCH algorithm. These are the only stuff which you need to know. This is very simple. You have a mass disaster or something, use MARCH algorithm. Feel free. It's the best method. I love this.